Hello, I am Monica Baluyat of PSN3C of Group 9, and I will perform an assisting a patient with eating. So here is the procedure. First, we have to check the medical order for the type of diet prescribed for the patient. Perform hand hygiene and put on PPE if indicated to prevent contamination. Identify the patient. Explain the procedure to the patient so the client can cooperate during the procedure. Assess level of consciousness for any physical limitations, decreased hearing or visual acuity. If patient uses a hearing aid or wear glasses or dentures, provide as needed. Ask if the patient has any cultural or religious preferences in food, likes and dislikes if possible. Pull the patient's bedside curtain to provide privacy for the client. Assess abdomen. Ask the patient if he or she has any nausea. Ask the patient if he or she has any difficulty in swallowing. And assess the patient for any nausea or pain and administer an antiemetic or analgesic as needed. Also offer to assist the patient with any elimination needs. Provide hand hygiene and mouth care as needed. And also remove any bedpans or undesirable equipment and others, if possible, from the vicinity where a meal will be eaten. Open the patient's bedside curtain. Assist to or position the patient in a high fowlers or sitting position in the bed or chair. Position the bed in the low position if the patient remains in bed. Also, place protective covering or towel over the patient if desired. Check tray to make sure that it is the correct tray before serving. Place tray on the overbed table so patient can see food if able. Ensure that hot foods are hot and cold foods are cold. Use caution with hot beverages, allowing sufficient time for cooling if needed, and ask the patient for his or her preference related to what foods are desired first. Cut food into small pieces as needed, and observe swallowing ability throughout the meal. If possible, sit facing the patient while feeding is taking place. If patient is able, encourage him or her to hold finger foods and feed self as much as possible. Converse with patient during meal as appropriate. If, however, the patient has dysphagia, limit questioning or conversation that would require patient response during eating. Play relaxation music if patient desires. And also allow enough time for the patient to adequately chew and swallow the food. The patient may need to rest for short periods during eating. When the meal is completed or the patient is unable to eat anymore, remove the tray from the room and note the amount and types of the food consumed. Note the volume of liquid consumed. Reposition the overbed table. Remove the protective covering. Offer hand hygiene as needed and offer the bedpan. Assist the patient to a position of comfort and relaxation. And also, remove PPE if used and perform hand hygiene. Hello po sir, magandang umaga po. I am Nurse Monica, your nurse for today. Sir, may I know your name?
Carly po.
Okay Sir Carl, ako pong magiging nurse ninyo, ako pong mag-aalaga sa inyo ngayong araw at pagpapakain ng almusal ninyo. Pero bago ko po kayo pakainin, meron po akong tatanungin sa inyo. Nahihirapan po ba kayong lumunok?
Hindi po.
Ang pagsakit po ng tiyan?
Hindi rin po.
Nasusuka po?
Hindi rin po.
Okay po sir. Ito na po ang almusal niyo, sir. Ha?
Para saan po ba yan? Hindi naman ako mahilig sa ganyan.
Ito po, sir, na kinakain ninyo, para makatulong para lumakas yung katawan nyo at the same time, may pangsuporta po yung katawan ninyo doon sa mga iniinom nyong gamot. So, kailangan po, kain kayo ng marami para at least agad kayong gagaling. So, ito po, sir.
Okay.
Subo po. Yan, sir. Ganado,
Hmm.
Ito po, sir. Tubig. Kamusta po ang lasa ng pagkain niyo, sir?
Tama lang po.
Okay. Sir, tubig po. Magtubig po kayo, sir. Wow, ang galing yan, sir. Ubus na yung pagkain,
Siyempre, gusto kong gumaling.
Yan, ganyan ang fighting spirit, sir.
Tama.
O, dahil ubus niyo na, sir, ayusin ko na po yung pinakainan ninyo.
Okay.
Sir, punasan ko po ulit yung kamay nyo. O, sir, iayos natin yung po nyo para mas komportable kayo. Ayan, sir, okay na po ba yan? Komportable na ikaw, sir?
Okay na po.
Okay po.